Awesome. Good afternoon, everyone. My name is Kamran Mirza. This is so exciting to see so many of you in the Zoom room with us today. I'm a hematopathologist at Loyola Medicine and one of the co-founders of PATSIG. And I wanted to introduce really quickly the PATSIG idea and concept before I hand it over to our board of directors and our amazing panelists for today's discussion. So a couple of years ago, when I started as a faculty member, I always wanted to be part of our pathology student interest group. And I realized that in my local institution, it had been disbanded because there wasn't enough interest. And what I realized is that many of you probably face the same thing. And that is that, we have 1 or 2 people a year going into pathology. And typically there's 10 or 12 people who are part of this interest group. And it's difficult to keep up the energy for just 10 people. And so Dr. Towery and I co-founded PATSIG, and it is a virtual way to continue connecting with like-minded people across the country and the world. So it's a student interest group. It's a special interest group for pathology. It's for all medical students, and it's for any other person who wants to use it. And the idea is that we can continue to provide some energy to pathology-interested students, even if their own institutions do not have a pathology student interest group. Obviously the pandemic really helped us in a way, quote unquote, only because many people got used to doing virtual things, and why not have a virtual interest group as well? And so we're 4,500 strong on Twitter or X or whatever you want to call it. And we have an Instagram presence, and we're very, very excited to be sharing with you pearls and strategies about the process of pathology matching, or whether it be about pathology practice. And so without further ado, I will hand it over to our president, Nisa, who will kick things off today. Welcome.
Thank you, Dr. Mirza. And hi, everyone. Thank you all for joining us. We are very excited to host this program director panel today. Just as a quick reminder, this session is being recorded. We want to thank you all for your attendance and hope that this event answers some questions that might be on your mind. My name is Anaisa Nisa Quintanilla Arteaga. I am the president of PATSIG. At this time, I'd like to invite the other members of the virtual PATSIG who helped plan this event introduce themselves.
Hi, everyone. My name is Jenna Angst, and I am the vice president of PATSIG.
Hi, everyone. My name is Jerome Givey, and I'm one of the event co-chairs.
Hi, everyone. My name is Tristan Jordan, and I'm one of the event co-chairs.
Hello, I'm Florette Chong, and I am one of the social media co-chairs.
Hi, everyone. My name is Samir Nasser, and I'm a social media co-chair.
Hello, everyone. My name is Ahmad Afifi, and I'm one of the social media co-chairs.
Our last social media chair that was unfortunately unable to join us today is Sarah Faruqi. So now I'd like to introduce our panel of program directors. If each of you can introduce yourself and your role and institution, that would be great. Let's start with our Dr. Mark Giffen. Go ahead.
Hi, everyone. My name is Dr. Mark Giffen. I am a forensic pathologist at Atrium Health Wake Forest Baptist Medical Center, which is in Winston-Salem, North Carolina, so sort of central North Carolina. I did my residency actually here at Wake Forest. I did my forensics fellowship at the Office of the Medical Investigator in Albuquerque, New Mexico, and I've been back with the program for the last 5 years, joining the program director this past year. 2 fun facts about me: in addition to being a huge Lego Star Wars nerd, as you can see over my shoulder, I also really like to implement microbiology in my spare time by brewing beer and by fermenting wine.
Wonderful. Dr. Jaclyn Watkins.
Hi, everybody. Can you hear me okay? And I'm oriented correctly, I hope now too. I was having a little bit of technical difficulty this morning. But I am the new program director at UC Davis Medical Center, which is actually a little bit of a misnomer because we're actually located in Sacramento, California, but part of UC Davis's undergrad campus as well. I did my training in AP and women's and perinatal pathology, all at the Brigham and Women's Hospital in Boston. I was then on faculty at Vanderbilt University Medical Center for about 3 years, and heavily involved in resident rotations there. And then I returned to Boston, and I've subsequently been on faculty at Massachusetts General Hospital for the last 3 years as an obstetrical and GYN pathologist. But this wonderful opportunity to lead as program director at UC Davis had come up, so we decided to relocate. And it's been really wonderful so far. In terms of fun facts, oh, and I'm associate professor there as well on a clinical track that has to do a lot with research as well for promotion purposes. fun facts, I've got two little rambunctious kids. So if you hear anything crazy in the background today, that's what's going on. We like to hike, and we're also huge Lego buffs, actually. So we're camping this weekend, and I had just finished an A-frame Lego kit. So it was perfect timing. So thanks all for having me today.
Thank you. Dr. Evelyn Lockhart.
Hi, everyone. Evelyn Lockhart here. I am also a new program director at the University of New Mexico in Albuquerque. I am a board certified blood banker and transfusion medicine physician who also specializes in laboratory hemostasis. Yay. Hematology is just, I'm a huge platelet nerd. So we are, I think, really fantastic, diverse program here. Some fun facts about myself. I am also a trained medical illustrator, animator, and had just done a master's degree in this up at University of Toronto. And in my spare time, I like to cook, and I also am a game master for Dungeons and Dragons.
Amazing. Dr. Rachel Gordezky.
Hi, I'm Rachel Gordezky. I am also a new program director at Loyola in Chicago. I've been the program director for about 6 months. I did my training in Chicago at UIC in APCP and did further training in DC in GU breast and cytopathology. I worked in DC for a few years, and now I've come back to Loyola, which is my home, so that's fun. A fun fact about me is I'm actually a classically trained ballerina. I grew up doing that somewhat semi-professionally, and then decided to choose a more practical career in medicine.
Awesome. And last but certainly not least, Dr. Gracelyn.
Hi, I am at University of California, San Diego. I've been the program director here since 2015. So maybe one of the people a little bit longer here. And in terms of my area, I am an anatomic pathologist. I trained in APCP, actually at UCSD. So I have stayed on. They've not been able to kick me out of there yet. My area is I am the director of our head and neck and cardiothoracic pathology service.
Great. Thank you all so much for joining us. I'm going to hand things off now to our event co-chairs.
Hi, everyone. Just a reminder, my name is Jerome. I'm one of the event co-chairs today. Big fan of the fun facts from all our PDs. But thank you all for coming. Thank you all for attending this event. And just to give a quick lay of how we'll run things today, we asked for some questions when you RSVP'd, and when we went through and chose some of the more commonly asked questions. And then if there's still time at the end of all our preset questions, we might open up to the chat. So all attendees are muted except for the panelists. And just a reminder, again, this will be in a recorded event. So we'll ask an event to one panelist at a time, but panelists, please feel free to, add your 2 cents in as well, even if we don't directly ask you the question. So we'll just open things up. Tristan, you want to get us started?
Hi, everyone, again. So to kick things off, the first question is for Dr. Giffen. The first question is, what's the most important factor in determining interview invites?
So this is kind of a complex question. So we started off with one of the harder ones. But the number one most important thing is that there is no number one most important thing for an interview invite. For our program, the way that we try and determine who gets an interview invite is looking at the entire applicant. We want to make sure that we're going to be a good fit for you and that you're going to be a good fit for us. And there's a lot of gray area because there's some people that are looking for very specific things. There's other people that could be happy pretty much anywhere that we go and train. And there's really no program out there that's not going to be able to make you a good pathologist. So a lot of it is about the nuances of who you are, what you want out of a program, what we want out of the people that come to our program, and how well we think that we're going to fit with what you have. So we try and do an overall holistic approach, looking at you as a candidate, where you're coming from, what kinds of things you're looking for in a program. And we can't always necessarily tell, which is why we go on to the interview phase of things. But we're also looking for what interest you have in pathology, what kinds of training that you're looking for. If you want something super subspecialized and we're a more general program, then maybe we're not the right fit for you. If you only say that you want to be in a large city and we're not a large city, then we're probably not a good fit for you either. So kind of in your application, putting forward the information about what you think is important is really what's going to get you to that interview phase for us. And I'd say the vast majority of applicants that we get fulfill most of those criteria. So then we're looking for the differentiation points. Do we have subspecialty that maybe you're looking for in training? Do we have other things that we think would potentially fit? And that's the additional criteria that we generally use to kind of filter who gets an interview. And then we will, if we send out our interview invites and it doesn't fulfill our needs, then we'll go back and we'll re-review the application. Sometimes things don't always go according to plan and your step 2 score didn't get released on time or something like that. So we do, put the little asterisk next to people. We should go back and look at these candidates again, make sure that when their information comes in, they have everything in them.
Is it okay if we chime in here then too, just to piggyback off of what Mark said? Okay, wonderful. In addition to taking a holistic approach and really looking at you as an applicant, one of the things that I'd love to see is some dedication to pathology and good exposure beforehand. Pathology is so different as a specialty than what you learn in medical school that I really err on the side of hoping to interview residents that know a little bit what they're going to get into when they start. I just want people who have explored within the availability of their medical school, because I understand that increasingly a lot of places don't have test rotations or have very limited ones. But I really love to see when someone has sought out a pathologist, maybe done a little bit of a project with a pathologist, definitely has rotated through maybe AP or CP pending availability and interest. So that's just a big additional factor when I'm looking at applications.
Thank you, Dr. Watkins. If none of the other panelists have anything to add to that, the next question actually is also for you, Dr. Watkins. What information should be absolutely captured in a well-written personal statement? That's kind of the one opportunity we have to really show ourselves. So
yes, absolutely. So, personal statements, I think, give a lot of people a lot of headache. And I will tell you that they're just part of the application, right? So it's the whole sum again. When I wrote mine, I wrote about glass blowing, which is a hobby of mine. So it was totally eccentric. Like I made it work how it was like a visually stimulated like field, and that correlated with my love of pathology and the scope, and tied it all together with glass. So a very whimsical essay, I will admit, relative to other people. But with that said, I think there's two things that can be demonstrated really well in a good personal statement. One is that you're able to communicate your interest in pathology. Very commonly, these are about your journey to finding the field, because again, we're not the most obvious choice sometimes for your average medical student. So I really like to read just how people found it, how they discovered it. I've read essays already this year just from people who are applying from my school in pathology, about their experience with pathologists, from cancer diagnoses, from friends, families, all the way through to, incidentally enjoying a lecture in medical school. It really runs the gamut of experience. But I will say that I really enjoy reading how people came to path. The other thing is it gives you an opportunity to explain sort of, maybe hiccups in your medical education. So for example, if you had to take a year off and you feel the need to explain to, the program directors, maybe what happened with that year or what you did with that year, it gives you a real opportunity to explain anything that you may perceive and think other people may perceive as little anomalies here or there, or just something that explains maybe a trial or tribulation you had in medical school. And for that matter, I love reading about those things too, things that people have overcome and what they've done and how resourceful they've been in overcoming adversities in their lives. So I think that really gives you the opportunity to explain those things that may need be explaining, but at the same time, explain where you're from, what have you overcome in life, and then simultaneously how you arrived at pathology. But again, they can really run and be very diverse in what they cover. And I'm always, at the end of the day, I'm really enjoying getting to know people through their personal essay.
One other thing that I would add. Sorry, go ahead.
I love to dovetail on some of the great things that Dr. Watkins was saying. I think one thing that for us in looking at personal statements, recognizing that for many pathologists, the clinical output, the end result of us that we're producing is a written report. And so for personal statements, it's really important to highlight your ability to communicate using the written word. And for me, this is that chance that you really want to be careful with. No typos, no grammatical errors. Get your friends or someone who's even a professional editor, look at that statement, because this is the one chance you have to put your best foot forward. I also think in looking at pathologists, I some of the misconceptions about pathologists is that we're kind of isolated, lone creatures, in a closet somewhere. And those of us who are, when and you recognize that you are a part of a very large team. And I really like to see that aspect of someone's experience with pathology too. How have you, if you want to highlight teamwork or communications or overcoming a challenge as a team, I think that shows how well you'll fit into our residency team and to the pathology department team.
That was pretty much exactly what I was going to say as well. So definitely check your grammar and your spelling. And, that's very important for us. The only other thing that I would add to that too is, it should be personal. Don't use ChatGPT to write your personal statement, because I've already played with that and I know what they look like. But in all seriousness, most of the personal statements that we read are going to kind of fall into a spectrum, and you want to make it personal and you want to make sure we understand who you are and where you're coming from. But the other thing is not to make it so personal that it gets awkward, because I think we've all probably read those personal statements where we think the person may have overshared a little bit or may have made it a little bit too personal for the setting that it's in. And granted, we may want to know about those things, but that's what the interview is for. We're going to talk about those things in a little bit more depth. The one that brings to mind was a couple of years ago, and I'm a forensic pathologist, so I'm used to the things that forensic pathologists put in their personal statement. But somebody had started talking about the thought of how the scalpel sliced through flesh, and it kind of started to turn into like a fan fiction serial killer personal statement rather than, and at that point, it as a forensic pathologist, I get it, but that's not necessarily what everybody in pathology wants to read about. So make sure it's personal, but not too personal.
Thank you for your insight, Dr. Giffen. Does anyone else on the panel want to add anything?
Can I just add one thing?
Sure.
Everybody's comments were wonderful, and so I don't have a lot to add. I would probably just say it shouldn't be a list of your activities, if that makes any sense. It should be more of how your journey and why this led you to pathology, rather than I did this, this, and this, and this, and where it doesn't really explain how that brought you into applying for pathology. Hopefully that makes sense as a comment.
Thank you, Dr. Lin.
If I can add in just the shortest little addendum too. Our residents may also be reading the personal statement. So I think it's good to keep in mind that whatever, to dovetail on what Dr. Giffen was saying in terms of oversharing, be aware that your future co-residents may have read the statement.
Thank you, Dr. Lockhart. So for our next question, this is actually directed to Dr. Lockhart again. So what, in your opinion, is the best approach to formatting the experience section of ERAS? Do you prefer to read bullet points or full paragraphs?
The irony here is that I'm just like I am so fastidious outside of that horrible ERAS structure in terms of formatting. I feel like I would say for personal statement, and this is an aside, that absolutely paragraph form, typical essay form. And this may be opinion. I'll be curious to hear what the other co-panelists. I kind of prefer bullet points myself. I like visual chunking of information, and just remember that the program directors and other faculty will have read through hundreds. So look at as much as possible to try and improve quick clarity for them, highlight things, structure things, just so you have kind of a visual hierarchy, and get your important points across first.
I'll dovetail off that. Oh, sorry. Please go ahead, Rachel.
I completely agree with that. As has been said, making a nice, well-written, without typos personal statement is really important. But when it comes to the experiences, it really just is easier to read in bullet points.
And I was going to say, when we're looking at applicants and we're discussing, when we're sitting back with our committee on resident selection, a lot of times we're thinking about people as the highlights of their career and what they've done. And so we not to say we think about people as bullet points, but the truth is we're thinking about your experiences in the same way as it would be, architecturally different if you did bullet points versus paragraphs. And so I find it's a very succinct way to highlight with bullet points what the experience was. It's nice to see that someone can communicate that experience in a succinct but comprehensive way. And then it honestly helps me remember you as a person, to think about what those itemized things were that set you apart perhaps from someone else.
Yeah, I think great points, Dr. Watkins. If you're looking at the subject matter our applicants should know best in the world is themselves. And so looking at the organization of their thoughts, the editing of that in the application speaks to how they will be able to edit and organize information in other facets of residency.
Thank you, Dr. Lockhart. And as a follow-up question to that, with regards to ERAS, since applicants are only limited to 10 experiences in their ERAS application, do you think it's appropriate to group similar experience into one experience on ERAS?
I think trying to how to say this, working within the constraints of the system to best highlight what is most important and relevant for your experience. So yeah, I think using not to have the section be overly detailed or anything like that, but being able to quickly summarize and cluster sets of experiences into one, I don't know, makes sense for me. But again, it's about how are you working within the constraints of the system to best communicate what is relevant about you as an applicant and making it as visually salient to the people reading your application as possible.
And if I can just add something to remember, we don't need to see every single experience you've ever had in your life. And that's, I think, part of why ERAS has constrained it to only 10 experiences this year, is give us the most important experiences that have made you who you are, that have led you to pathology or other really important aspects of your life. And I think if you think about it that way, what are the 10 most important experiences, it'll be easier to whittle it down.
I agree with Dr. Lockhart and Dr. Gordezky. I know I just butchered your name. I'm really sorry about that. But I think that one of the most important things is focusing down on those experiences which shaped you and made you into a good physician and a good pathologist. And the applications we used to get when you had that open experiences section, there'd be like 75 community outreach. Like, I went to a blood draw fair and I went and I did a blood pressure. And not that those things aren't important and that those things are part of shaping who you are as a physician, but reading through 10 separately listed ones, you start to lose some of the impact and importance of something that you may have put down the list that was really important. And so if that is something that's really important to you and an experience that you had that helped shape you as a physician, absolutely listed in there still. Condense them down and say, I did 7 of them over a time span. Here, I went and did this community outreach. I went and traveled to wherever and did this thing. But highlighting especially the first, second, and third experiences should really show us who you are and what you want to be when you become a pathologist and you want to come into a training program.
Thank you, Dr. Giffen.
I think Dr. Lynn, did you have something you wanted to say? Were you raising your hand?
Oh, I was, but you raised your hand first.
No, after you, please.
I was just going to go on with Dr. Giffen's remark that if it is something where you have those, you could always say, my examples of volunteerism or volunteering is very, very important, or community service is very important to me. And these are some examples of what I've done. And so rather than have 10 experiences of your volunteering activities, you could potentially group those quite appropriately.
Yeah, I'm actually seeing a great point in the chat. Choosing the most important experiences may lead to the appearance of false gaps in CV. So and seeing several folks highlighting that. So maybe we could address that. I think trying to make sure you have a cohesive narrative to what your training and work experience is that is important as well. For me, the point I was going to bring about the experiences is there may be great experiences that you might have the notion that it's like, oh my gosh, this isn't really healthcare related. But there could have been a set of skills that you learned in that is incredibly useful. Like I had an applicant one time who had extensive experience as a bartender. And I know what that means, that they are able to prioritize triage in a moment, be able to deal with a chaotic, and for me in transfusion, that was like, oh my gosh, now I know they're going to be able to handle when there's multiple calls coming in. So I think that's it really is a chance to, if you want to, explain it, be like, this is what I learned as a life experience, even though this may not seem directly related to healthcare. I learned how to empathically listen. I learned to balance multiple stressors, like.
And I'll just add too, for those who are concerned about this gap issue, there are so many other parts of your application, right? So let's say you're in a lab and you publish 3 papers on the exact same topic, but you really want to include 10 experiences, one of which is not the research lab. Well, I already know from your application that you published these 3 papers, so I can kind of infer that you've had research experience already. So just for those, just think about it as a whole approach. What needs to be highlighted that maybe isn't obvious elsewhere on the application, or doesn't have a clean, concise slot? Not to say that a research experience shouldn't also be listed there. It probably should be, so that I understand what kind of environment and lab you were in. But again, you can use that to complement the rest of what is very obvious within your application, perhaps.
I believe there should still be a significant work experience section. At least that I don't believe they've gotten rid of that. I hope.
Well, and Dr. Lynn has made an excellent point, is this is new to all of us reviewers as well. So, and in past experiences, if I do see someone that has a significant gap in their CV, that doesn't mean I'm not going to interview them, but I will probably ask about it in the interview. So even if you have an experience that just you don't think is that relevant, but it makes it look like there's 2 missing years in your life, just be prepared to answer a question about that, but it doesn't mean you won't get interviewed.
Thank you all. That's really, really helpful. For me personally, that experiences section is one of the harder ones to kind of navigate. And then Dr. Gordezky, kind of towards you, how important do you think like research experience and publications are when considering an applicant?
I think for me, it really depends on what kind of programs you're applying to, and more importantly, what kind of career do you want? If you tell me that you're interested in working in academics and doing all this research, but you have 0 research experience, or you've only, published a case report, that's a little bit suspect. But if you tell me, oh, I did this 1 research year in med school, but I really want to go into private practice, I'm not that concerned that that's the only, you did a research project over the summer between 1st and 2nd year, that's your only research experience. That's fine. So I think it depends on who you are and where you want to go and the different programs you're applying to. Yeah.
I'll piggyback on this one and be a little candid about this particular thing. So all of your program directors you're interviewing today, right, are in academic medicine. So I think in general, academic medicine, which is most of our training programs, I think there's actually different types of residencies when you're really applying. I went to the Brigham, I've been on the MGB selection committee, and I will tell you that at a place that has an extremely academic reputation, meaning most of the faculty are publishing a lot, there's an expectation for the faculty to publish a lot. At environments like that, there is a heavy weight on what sort of successful research experience you have had. Now, with that said, when I applied back, I had not published. I had done research. I had written a master's thesis, but I had never actually published a paper yet. And I still got interviews and I still got accepted ultimately. But the point is, now having seen the other side, which is sitting on the selection committee, there are different sort of tilts to the programs. And I think it's kind of obvious when you're applying which type of environment you're looking at. And so if you're a very academic person and you want to stay super academic, I think you're going to get that sense even just from their website, what's going on from sort of the reputation of the institution. And yes, places like that are going to put a heavy emphasis on your productivity, and even may, bump up applications in theory that are PhDs in addition to MDs and things like that. But we all kind of, I think, expect that. It's sort of like, middle tier pathology where we're all working in academic environments that actually have a really mixed bag. Like I have colleagues who don't publish and do a ton of clinical work. I have colleagues that are, working in the lab 80% time and then doing a little bit of clinical sign out. I think we're expecting more of a diversity of applications, meaning we're going to have people who are heavy on the research side and people who are not. And I think while I love seeing that people have done research because I am on the research side of things and I'm always like, ooh, I could work with this resident down the line and we could write together. At the same time, I'm realistic about the fact that some of my trainees are going to want to do private practice, and I'm not going to hold that against them, that is exactly what their sort of avenue is and what their interests are. In fact, I like when people sort of are very open about and candid in interviews about what their expectations and goals are, because then I can craft their training a little different too, right? If they're going to be doing general pathology sign out, I need to know that early, right? So that I can make sure that it reflects their training. Whereas if they're going to want to go and be an academic clinician with a lab, we have to be thinking about that approach a little bit differently. So at the end of the day, I love to see it. Do I have to see it? No. If it's not there, I think that's where, and I'll harp on something I mentioned earlier, where I will definitely want to see that people have still had experience in pathology, because research in path is like an obvious, oh yeah, I've seen path, I've been looking down the scope, I know what I'm doing kind of thing. And if you don't have that research, then I think the nice sort of other thing to have in your application is just demonstrated interest in pathology, because that's really what I want at the end of the day, is an enthusiastic cohort of residents who are committed to our field, who are excited to learn, excited about our field, and really are going to flourish together, meaning they also should be collegial, because no amount of application like publications really will trump someone who, you know, I think is going to not jive well within maybe our department necessarily, to be entirely frank with you all. So again, there's not a cookie cutter applicant. It's not that you have to have them. Can it help? Absolutely. But again, I think demonstrating just success or experience in the field is most important at the end of the day.
If I can just add to that, I totally agree with what you're saying about experience in pathology, because I've interviewed people in the past who had a ton of research experience, but had never actually seen what the practice of pathology looked like. And it was very obvious when I was talking to them in an interview, and they ended up not being ranked. So, you know, again, there's no one right way to fill out an application, but showing your interest and experience in pathology is going to be really important.
Thank you, everyone, for. Oh, go ahead.
Can I add one thing? If you do list a significant experience in research, make sure you're comfortable explaining it. We do, you know, if you put that down, we may ask you about it. And if you're not comfortable explaining what you did and why you did it, and then it actually ends up being a negative rather than a positive.
And I'll add one thing to Grace that I've just seen sort of flagged in the past as it's not worrisome, but it makes us question a little bit, is if you've been in the lab, like you spent a year doing research, or you did a PhD, or you have a master's or something along those lines, and one of your letters of rec is not from your research mentor, it sometimes raises like a, I wonder what happened in that lab environment. Meaning just that when you have a really significant experience like that, it's a really good thing to also see one of your letters come from someone who worked closely in that environment with you. Because it also gives us a good sense of how you were collegially within the lab, how you were committed to your research project, you know, all of those different things really come through in a really candid way from your mentor.
Thank you, everyone, for providing insight to this very important question. I want to move on now to the next question, and this is directed to Dr. Lin. So as we kind of touched on earlier, program signaling is new to pathology this year. So how does your view of applicants change if they do or do not signal your program?
Well, this is the first year of it, so I don't fully know. My thought at this point is I'll probably review the applicants that signaled us first. And then, you know, we'll still use our standard criteria for evaluating them. And then I'll probably go on to geographic preferences second. I don't know what it's going to look like. I don't know if we're going to get 2 signal tokens. I don't know if we're going to get 200 of them. So it's completely new for us. So I don't fully know the answer to your question, I think.
I agree with Grace. Like, we don't really know what to do with this 100% yet, but I will tell you that at least at Davis, the med school is strongly advising our applicants across all specialties to signal. So if you have not heard that advice, just know that there are other schools out there that are really like indicating to people that that's very important. So it may be something to think about if it's going to end up being interpreted one way or another by us, that you might want to do it if you do have honest preferences for a geographic location or a particular program. The other thing that used to happen, and I think still will, is, you know, we can never do quid pro quo situations in the match. So I can never say, oh, if you rank us, I'll rank you, you know, that kind of situation, of course. But it is not an uncommon practice for individuals, once they've interviewed everywhere, to reach out to a program and say, you are my first choice, with like an honest email to the program director. And historically, there were people applying who didn't know to do that or weren't ever told to do that. And I actually think it could hinder you sometimes because simultaneously there were all these med schools encouraging people to let their favorite program know this, and it does alter rank list a little bit. So I think what's nice about the signals is it does counteract this awkward and not everybody was informed experience of getting in touch with your favorite and letting them know. It's just like another way to do this that also makes it like an obvious choice for everyone, as opposed to something that you kind of had to hear about behind the scenes, if that makes sense.
That's really helpful from you all. As the signal's new this year, we're all kind of left raising our hands, asking questions. And kind of in that same vein, Dr. Giffen, in the geographic preference, you can select no preference for a geographic area. What, if any, weight do you put into someone who has no geographic preference?
So this answer is probably going to sound very similar to the last answer you just got, because this is brand new for us as well as for you all. I am not going to look at an application if it doesn't have my geographic preference and say that this is not somebody that I'm going to interview. It's pretty much going to be the exact same thing as it was previously. I'm going to look at you. I'm going to do a holistic review of your application. Now, maybe when we get time to rank, if you're listed in the Southeast region and you're interested in it, that may alter our ultimate rank list, because, you know, we want to give ourselves the best shot and you the best shot of ranking at a program that you want to be at. But ultimately, I don't really know, because I don't know how many people are going to be putting, you know, this information in. I went to the program directors meeting in Chicago, and they talked both about signaling and about geographic preference. So they did use this last year in some programs. So I kind of got a good idea of how some of the data that got put out there. It seems like for program signaling, that people who signaled programs were more likely to get interviews if they were, especially if sort of they were in the mid-tier kind of categories. That, you know, maybe some people gave out a few more interviews to those sorts of people. Same thing with geographic preference. If you have a geographic preference and you're sort of in one of those mid-tier categories where, you know, I'm on the fence about whether you're going to get an interview from us, you may be slightly more likely to get the interview. The other thing that's nice about pathology is we only get a limited number of signal tokens. So with, you know, just kind of combining these two things, because it's probably not going to be one or the other. It's probably going to be a combination of the two that we're using. If you send me a signal token, it means that you are really interested in my program. You don't have 90 of them to give out to, you know, every program in the US. So, you know, we will use that probably as a weighted factor. But also understand that if you list a geographic preference and you send us a signal token, if I don't think that you're going to be a good fit for our program, it does not necessarily mean that you're guaranteed an interview. You know, maybe you have misconceptions about our program, or maybe you have a lot of things that just aren't meshing with how I see our program and the residents that we have, and what your real strengths are and where I think that you can succeed. So, you know, it's going to be a learning process this year, definitely for us, but I do think it is going to be something that we weight both in going into the interview cycle as well as when we get ready to form our rank lists.
Thank you all very much. And there's actually one really great question in the chat I just wanted to touch on real quick, is for international grads and their geographic preferences. Is there, I know, again, it's a new thing, but for US versus international grads, do you weigh the geographic preference any differently, or think you might?
I don't necessarily think so. So whether you show me that you have a geographic preference or you, so just, I don't know if everybody understands sort of how the geographic preference works, but if you don't list the Southeast region for me, it doesn't show me that you have a geographic preference. If you list no geographic preference, it doesn't show me that you have a geographic preference. So you look exactly the same either way. And I'm not going to infer one way or the other that you either didn't want to be here or you didn't list it. So it's really only if it's a positive attribute that you really do want to be in this area. And this is sort of taking some of the guesswork out of what we used to do when we were looking at applications anyway, because if your hometown's in the Southeast and all your family's in the Southeast and you've gone to college in the Southeast, I kind of figured you wanted to stay in the Southeast. That's not always true. but it's taking some of that guesswork out of that. That doesn't necessarily mean that if you don't match, here and you match in California, you didn't want to go to that program because you wanted to move across the country and try something new. So it's clarifying some of those sorts of things for us, but it's not going to be a negative or held against you, especially if you're an international grad who just wants to match into a good program and get a good training.
Thank you for offering your insight, Dr. Giffen. So to add on to that, for an IMG, how important is it to have already taken and passed step 3?
For me, I mean, I think it's important, but it's not necessary. If I'm how I look at it is if I'm looking at an IMG or two candidates that are in a similar place and one has passed step 3 and one hasn't taken it yet, the one who has passed step 3, I might move up the rank list, or I'm a little bit more likely to interview, because that's just one less thing that person has to deal with. Does that mean that an international grad who hasn't yet passed step 3 is not going to get an interview or not get ranked? Absolutely not. I actually have 2 residents in my current first-year class who are international grads that have not yet passed step 3. But how I envision it is if you have passed step 3, that may potentially move you up on the rank list a little bit.
Yeah, I build on that in that recognizing that for some programs like UNM, our GME office will fund step 3. I agree that this is something where it really is great to have that hurdle taken care of, that any lingering concerns that we would have as a program for you, that's great. But yeah, no, we will, if you haven't passed step 3, we would still be looking at you as a candidate, and based on the strength of your application, you could come here, and it might actually be a little bit of alleviating a small aspect of a financial burden. So that's a detail that's worth looking into for the programs you're really interested in.
Thank you. That's really helpful. And kind of in that same vein, for Dr. Watkins, this year or recently, step 1 changed from score system to pass fail, and it's kind of starting to be at the point now where applicants will be pass fail for step 1. What are you going to do with the mixed pool of applicants who have a step 1 score and are just pass fail, and does making step 1 pass fail put a little more weight into step 2 scores in your eyes?
Yeah, I think this is a hard thing. This is a big change for us. I think historically, a lot of programs across subspecialties used sort of minimum criteria scores as sort of an easy way to sort applicants. Not to say they never interviewed outside of that, but it was a quick and easy score, the way that an MCAT score is, right, when you apply to medical school. So, I'm not totally sure what we're going to do. I think the signal I'm supposed to read into this change is that perhaps there's some, bias inherent in having step 1 scores, and I have seen it, demonstrated differently across medical schools, which is like some medical schools will give you like 6 weeks to study, some give you no time. So yes, there are differences there. There are differences in outcomes, we know, in standardized testing amongst race, amongst region, all of these things that are super biased when it comes to that type of testing. And so knowing that, then it should be sufficient that you have passed, right? That's really where they're heading in terms of medical outcome. Now, with that said, it is so hard as someone who grew up in this culture of everything gets a grade to not have some mental weight placed on it. So yeah, I'm probably going to look at your step 2 scores more across the board, since I can't really read much into step 1, because I don't think it would be fair to do that to applicants who have, the pass fail to be compared to people with a numeric score. But step 2 is also kind of, in a way, a better test. It's a little bit more practical knowledge in some ways. It's sort of how you function in clinical decision making rather than rote memorization of fact. So, in some cases, I actually prefer to look at the step 2 scores than the step 1, because it's like, how much did you learn on the words? Like, how were you integrated into the team? But I don't know yet that I'm going to instill some type of institute some type of firm cutoff for that. And I'm actually curious how other programs are going to be approaching this as well. So I'd love to hear from all the other PDs, because this is such a new and sort of a different approach to this, what we viewed as a very objective criteria for on your application.
Yeah, our group is actually, this panel just happened to, beat us in terms of the meeting that we're going to be having to really unpacking this, between myself, the rest of the residency program leadership, and looking at this. But I agree. I think step 2, it's good to see that because of looking at it as kind of like the cognitive apprenticeship that's going on in wards, and that being more akin to what the learning environment and experience is going to be like in a pathology residency too.
Yeah, for us, we had some of this starting to spill over into last year, so we already had to start thinking about it. And I think for the step 1 pass fail thing, if you pass step 1, you pass step 1. We're not looking at that numerical score. It shouldn't be held against somebody because they took it at a different point in time, because your pass may be a high pass, it may be a middle pass, it may be a low pass. There's no way for us to be able to do that. Step 2, we are still using that as a metric, but again, we're looking at everything. You may not be a good, as Dr. Watkins said, you may not be a good test taker, but you may be a phenomenal pathology resident. So we want to look at a little bit of everything to see how you're going to do, because that end all be all is not the test. We want to make sure you're going to pass your boards at the end of it, but we also want to make sure that you're going to be a competent pathologist. One thing especially for those of you that aren't 4th years and are kind of getting this as an early, thing, I have seen a little bit of a trend following different things on some social media platforms that them going to pass fail for step 1 seems to be shooting some people in the foot, especially if you don't have a lot of dedicated time for studying, that some people aren't putting as much effort into studying for step 1, and therefore their medical based knowledge isn't necessarily as strong going into step 2 when you're starting to really study for that, and where you thought your scores were going to be are not where they are. So make sure that you are still putting as much effort into studying for that test, because it's important knowledge. You need to have this in order. And, though it is a lot of rote memorization, it's also a lot of the base knowledge that you need in order to be a good pathologist, because so much of our pathology is clinico-pathology. It's not just looking at a slide. It's not just interpreting a test. It's putting an entire patient's picture together in order to make the right diagnosis. So, and I would pass that down to anybody that's first, second year before they take their step 1. Just because it's pass fail doesn't mean you don't put as much effort into getting that knowledge.
Thank you, Dr. Giffen. That is very helpful to know. So this next question is for Dr. Lockhart, and this question is geared more towards the latter parts of the application process. So what are some virtual interview do's and don'ts?
Oh, I'm glad I got this one. So I think this is at baseline, all the do's and don'ts for Zoom, like have a reasonable, clean environment. If the bed is behind you, make sure it's made, make sure you're dressed appropriately, groomed appropriately. Sorry, I just recognize some folks may have that in the background. Y'all are fine today. This isn't the interview. But also some things like make sure your internet connection is rock solid and check it beforehand. Be well lit. For folks who are backlit, it's really challenging to be able to see your facial expression. And so making sure that your facial expression is able to be seen is very important. try your best to try and do a sound check and hear what your microphone sounds like. Some folks, you may be working with earbuds or something like this. I kind of go to an extreme. I have a Blue Yeti, and I think it's really important. Recognize that you have to compensate for the other side. Like the person on the other side may not have great speakers. So if you have bad speaker output and kind of questionable mic input, sometimes it can be difficult to hear. So as much as reasonable, you can get some of the good headphone mic sets for relatively inexpensive. And then these are all the, so that's just all the AV stuff. And then it's all the parts about being ready to interview, which is understand, know about the program, show that you've done research into the area, recognize that every person you interact with is going to have the opportunity to give input into you. So not just the faculty, it may be the program coordinator who's bringing you in. As soon as anyone can see you and hear you, you're on. Be careful of those hot mic moments too. If you think you're muted, be careful just with this. So do's, these are, and for don'ts, I think it's challenging. I'm more an extrovert, so it's you ask me a question, it's not a problem for me to keep going. For others, it may be a little bit more challenging. You may be more introverted. It may be good to practice with a friend or a colleague if you do have difficulties in generating answers on the spot, just to make yourself more comfortable with the process. And then follow up, don't ignore emails from the programs. Try and be prompt in responding to programs. And at the end of the day, this is just about having a chance to learn about the fabulous person that is you. So we're really excited. We're looking forward to meeting our future residents and colleagues. And so if you can bring that energy to the interview, I think you're going to be really well served.
That is excellent advice for your interviews, all the way from good lighting, good background, because it can get distracting sometimes, all the way through, to presentation and being prepped. One of the things that is extremely common in pathology is for people to leave about 5 to 10 minutes at the end of an interview for your questions. Now, you may be on interview number 6 and be like, I don't have any questions. Don't be afraid to ask the same question of every single person, just to have like a go-to, this is what we're going to talk about. Because it's actually just so awkward on the other end when someone says, oh, I don't have any, even if it's an honest response. They may have learned everything they need to know, but it's a good way to fill time a little bit sometimes, and it's a good way to breed like additional conversation. So, have a go-to list of maybe 3 or 4 good questions, like either about the organization, how fellows get along and residents get along, what's the division of labor, all these different things. It can be any topic really that you want that's specific. It could even be about the geography of the area, like for me, what's Sacramento like? And I could fill you in at that point. So really just have a go-to list. It's going to alleviate a lot of concerns and worries. The other thing is that some programs will offer sort of a virtual opportunity to do additional things, like to come into a lecture that maybe you didn't get to see the day before, or sit in on a sign out virtually for a little bit. We cannot take those as signals of interest, but I'm not going to say it doesn't hurt that if you've done additional things or you've had the opportunity to do it, if you reach out and want to sit in on like a virtual interview or a virtual sign out or something like that, it's a good thing to follow up. But again, the key to that is to read the follow-up emails from the program, because if you don't happen to notice that, you won't even know that that was an opportunity that might help you make your decision. So just something to be aware of, that some programs do that type of thing where you may get to revisit another day virtually just to go to grand rounds or something like that. So keep that in mind.
Thank
And
you.
one other thing, I'm
yeah.
sorry. One other thing that I would add is definitely to take notes as you're going through. That's a big do for me, because a lot of people don't realize early on, if you're interviewing at 20 different programs, by the time you get through 5 of them, things are going to start running together. So you want to make sure that you can differentiate between them. And I do it too. And let the interviewer know that's what I'm doing. When I used to be in person with you, it's really easy to see what I'm doing. But, if it looks like I'm just looking over here all the time, I don't want to come across as disinterested or like I don't have interest in what you're doing. Just write some quick notes down as you're going through. And for us, there's a couple minute breaks in between our interviews. So that's when you can kind of flesh out some of that information. But I need it to remember who you are, but you also need to remember what makes my program different. So remember to take those things. And I tell everybody this story. So if you're interviewing us, you may hear it again. But also, if you have a question that comes up later on that you forgot to ask from programs, like, oh, that seems really important, I didn't even think about asking that, email the programs back. It shows interest, and it also shows that you want to learn more about the program, because it may be something that's really important for you that you hadn't thought about early on in the interview process.
And if I can just quickly piggyback off of that, I know whenever I'm interviewing, from when I was interviewing in med school to interviewing for jobs, I do have a question list written down or on my phone or on my iPad, what have you. So if you need to look at that, that's totally okay. But like Dr. Giffen said, tell us that's what you're doing. Like, oh, let me look at my question list and then I'll ask you some questions or something like that.
Can I just add one more thing? We actually have a separate website that we send out when we actually have the invited interviewees rather than just the public website. And so sometimes it actually has like a bunch of videos and stuff. It does look kind of funny when people ask me questions, and it's pretty clear that they haven't even looked at the additional material that was provided. And so that's another reason to follow up on, make sure you read the invites and if there is additional information.
Thank you all so much for that. That's really helpful. I'm at 4 minutes after, and I just wanted to get one question in from the chat because I've seen it pop up a few times now. Feel free, any of you all, to answer. But for IMGs, how important is it to you all that they are ECFMG certified to receive an interview invite? Dr. Lynn?
Sure. I actually do look for that ECFMG certification. If they aren't, there's a reasonable chance we can't rank you either. Our GME office will not let anybody who's not eligible. So fortunately, California has gotten rid of that, what was it called, the PTAL or something like that. Because with the previous PTAL, there was absolutely no chance. If you don't have an ECFMG certificate, you couldn't get your PTAL, and thus would never be able to start training. And so that's kind of the limitations in terms of, so not to say that we've never interviewed people who do not have their ECFMG, but there's a reasonable chance I'm not going to be able to rank you if you don't have one by January.
Does anybody else want to add anything?
I have the same exact thing to say as Dr. Lynn. I definitely noticed that, and may still interview you, but may not be able to rank you.
Yeah, it's the same for us.
Agreed.
Policy.
Yeah. So that brings us to the close of our panel today. Thank you so much to the program directors for such a great and insightful discussion today. So just to close, I just want to open it up to any of the program directors if they have any last words of advice or comments to the applicants.
Well, since I started things off, I'll end things off first. First of all, congratulations on making it this far. You are going to do perfectly fine. As much stress as you have right now, I know things are opening up this week. Just keep working on it. Get your lists in, and make sure that your applications are as complete as they can possibly be. Remember that this interview season, as it comes up, is a marathon and it is not a sprint. It is going to be long. There are going to be times when things don't line up appropriately, or you have that AV accident. It happens to all of us, and we totally understand. Just be transparent about it. Have open lines of communication, and we on the other side of it have the exact same problems, and we are understanding of what's going on. In a couple of short months, even though it doesn't seem like it, you're going to hopefully get your match letter and figure out where you're going. And, then it will be time to celebrate and have fun, but there's a little bit of work to do in between. And then, of course, because I have to plug my program a little bit, we do have an open house this coming week. So if you would like to sign up for that, make sure to check out our social media and our website to do that. And thank you all very much, both panelists and everybody who is here today.
And I'll just chime in. Good luck, everyone. Thank you so much for your interest and for being here today too. And thank you for the invite from the SIG group. It's a stressful time, but you're going to make it through. You're going to find your right home in pathology. And a lot of it is about you all getting to present yourselves and getting a say in where you want to train rather than it just being about our side. So just keep that in mind. You do have a little bit of a choice here. And unfortunately, a big say in where you end up, even though I know the match system sometimes makes it feel like that's not the case. But just a big good luck. And if you have any questions about Davis, reach out to me, please. But otherwise, good luck with the season and feel free to email me if anything else comes up later.
And for those of you interested in Chicago and Loyola, we do have an open house coming up in a couple of weeks. So check out social media for that. And again, good luck to everyone. And if you have any questions about Chicago and Loyola, feel free to reach out to me.
And best of luck to everyone. This is a tremendous transition time for you. Remember, it's through the grind of all this to take care of yourself, be kind to yourself, have faith in yourself. You are the future of healthcare. You are the future of pathology, and just have faith in what your future contributions are going to be, because I know we're really excited to see what the future lies for you. So best of luck.
I'm not sure I have very much to add, but just want to thank everybody. I think this is wonderful it's a holiday weekend, so it was lovely to see all of the people who actually were able to join us for this. And so very, very excited and hoping to meet many of you on the interview trail.
And again, thank you all so much to both everyone who attended and all our panelists today, especially on a beautiful Saturday, at least here on the East Coast. Just a quick reminder as we wrap things up, the session was recorded and will be put online in the next few days. We'll be sending out another email to everyone who's RSVP'd for feedback on the session. So we'd really appreciate any feedback if you have any. And then just want to plug a few things that the virtual PathSig is doing. Our next big event will be the Fall Symposium. So please just follow us on Twitter, Instagram. You have a social media, we probably have that form. So please follow us and stay tuned for all our future events. But thank you all so much. This has been a really, really great event. We appreciate all of your insights and questions.
Thank you all. Thank you.